Hello, my name is Jasmine Stewart, and for my musculoskeletal project, I will be using myself as a client. So first, I will start with my participant profile. First, the physical assessment. I am 23, I'm a female, I'm 180 pounds, and I'm 5'6". I'm flat-footed and I'm right foot dominant. I only wear Vans, which are flat sole shoes with insoles from Walmart, and my assumed pathology pre-testing is to be no foot stability. As far as physical activity history, for sports, I played soccer for 13 years and I also played basketball for 6 years. 3 of the years of playing soccer, I played for two teams at the same time, and 6 of the years I played basketball and soccer year round. As far as training, I started some form of weightlifting in 2017 and I continued to do that until 2020. However, it wasn't until 2018 that I had formal guidance for weightlifting, so that means some form of assessment of my overall technique with lifting, as well as being introduced to Olympic lifting that I continue to use since 2018. I have also never tested my one rep max in any lift, and at most I tested my 5 rep max on a deadlift. For the pandemic, since it started, there's been no form of weight training. There's been an overall decrease in movement, and there's also been more sitting and laying in bed since March 12th until now. Um, from April until August, there has been walking about 2 miles through a very hilly neighborhood about 3 times a week. In April, for a class project, there was about 4 weeks of a body weight resistance program. And then in June to July, there was an attempt to do a 10K running program. However, this was cut short and lasted only about 5 weeks. The setup of the running program was to progressively add about 3 miles every week. There were 4 days of running and 3 days of rest. For injury history, before we move on to, it should be noted that overall there's no day-to-day pain from any of these injuries. From 2008 until now, there is a left ankle pop. So when I rotate my ankle internally and externally only for my left ankle, there's a popping sound. There's been no form of physical therapy to address this issue. In August 2010, there was a right ankle sprain. It was non-contact and happened during a practice session. I was given a boot for 2 weeks and taken off the boot when I felt no more pain. There was no form of physical therapy after my boot was taken off. From August to November 2014, I experienced shin splints in both of my legs. This developed during preseason and continued on for that season. And there was no form of physical therapy to address the issue. However, stretching and rest was used to alleviate the pain. From September to November 2015, there was calf tightness, both of my calves. This developed during the season and continued throughout. There was no form of physical therapy to address the issue. However, the pain was alleviated with Tiger Balm. In June 2020, there was pain in both ankles, again from the progressive 10K running program. About 4 weeks in, there was pain in both my ankles to the point of me needing to sit down and rest overall for multiple days. There was no physical therapy to address this issue. I just rested and did not continue my 10K running program. From June to August 2020, there was back pain. It started in the lower back and then moved up slightly to my mid back. I speculated this to be from sitting and laying in the same position for multiple hours and days. There is no form of physical therapy to address this issue, but I did stretch to alleviate this issue, and I also tried to limit how much I'm sitting and laying in the same position. So for the FMS assessment, to start with the squat. So again, this is the frontal view. So as you can see here, my knees are over my feet, so they're aligned. However, I noticed at my third rep, which I didn't use as my best rep, however, I did note that the dowel leaned more towards my left side when I was squatting down, so I made note of that. And this is my side view. So as you can see from here, I do have my upper torso is not in line with my tibia. However, I was able to maintain the dowel over my foot position by excessively extending in my upper thoracic spine. So I did note that my upper torso was not parallel with my tibia. However, the dowel was in line with my feet, but I did make a note of how I compensated to accomplish that. Also, as you can see, my femur is not below horizontal. It is above. So because of these compensations, I added a 2-inch bar under my feet. So with that compensation, as you can see, still my knees are aligned with my feet. And as you can see here, now my upper torso is in line with my tibia now that I've added the 2-inch stacks under my feet. Again, the dowel is still in line with my feet. But as you can see, as I continue to do more reps, the dowel kept pushing back more and more. This is because I was overextending in my thoracic spine even more. So for this repetition, I didn't mark myself down as having the dowel over my feet in my notes, but going based off my best rep, I said I did. But again, I did note that as I continued to do more, the dowel was being pressed back more and more, so it wasn't over my feet. Also, again, my femur, although it did drop down more, it's still not below horizontal. So overall, the score I gave myself was a 1. So next is the hurdle. So for this first repetition, again, this is not my best rep, but I did make notes from this. So as you can see, the dial is moving down towards the leg that is moving, so I'm not keeping a straight line. I do know my string is not straight, but I can tell that my dial did move down more towards the leg that I'm moving. Also, you can already see that my ankle, knee, and hips are not in line in the sagittal plane, so I didn't give myself that point. Also, I did notice some lateral flexion in my lumbar when I was trying to lift my leg. Also, you can't tell, but I knew when I was taking the test that for this first repetition, I did not have a soft knee. It straightened out almost to hyperextension, so I did make a note of that afterwards. Again, the same thing with my left leg. My hip, knee, and ankle are not in line. Also, even though I did make it over the string, it was noted that it was very difficult for me to lift my leg without having to hyperextend my knee. So again, I made note of that. And then from the side position, if you look in the back, you can see that in my lumbar spine, there is some movement there, a bit of flexion. It's not that noticeable, but you can see that still I'm flexing in my lumbar to lift my leg up. So overall, I gave myself a score of a 2. So now for the inline lunge. So as you can see, as I'm in the bottom of the lunge, you can't see my back legs, so my legs are in line. Also, I had no trouble getting my knee to touch the board I made. I did not see any torso movement in my lunge. However, I did see a slight wobble, as you can see it more with the second repetition. From my understanding, based on how we went over the FMS, when you say lumbar movement, you mean lateral flexion. But when I look at this, I understand this more as my lower body not being stable enough. So I did make a note of that, but I also said I did not have any torso movement based on my understanding of how it was explained to me. So again, for the other side, same thing. You can't see my back leg. My knee touched the board, and there was a slight wobble, but again, I saw that not as a torso movement, so I gave myself a check mark for that.